Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the Patty Brisbane Foundation for Women's Sexual Health. I'm your host, Patty Brisbane. If you're on the fence on whether you should use a personal lubricant or just don't know where to start, today's podcast is for you. I'm joined by Dr. Michael Krychman, Dr. Sheryl Kingsberg, and Vice President of Pure Romance Product Development, Erin Harris, for this convo on lubricants. It's everything you've always wanted to know, but never asked. Let's get started. Dr. Krychman, why should you use a personal lubricant, and what are some of those benefits?
Well, Patty, thanks for having us here today to talk about this really important topic. It's really, I think rather confusing. There's so much information out there, misinformation, and it can get very confusing very easily. And I think your question is really spot on, is who could benefit? And I think there's a lot of misperceptions, right? We think that lubricants are really just for dryness and really just for maybe older couples who are having a problem with menopause and changes in hormones. But let's not forget that there are, over 300 medications that everybody takes that are very common that may cause dryness as well. So, the misperception that is just for older people is really a fallacy. And the other issue that I think is really important, I know Erin will talk about this as well, is that a lot of people are using lubricants to kind of enhance the sexual journey, enhance pleasure, break up sexual boredom, bring something new into the bedroom, which is not uncommon for couples, that sometimes the same old routine becomes humdrum and boring, and bringing a new lubricant into the bedroom may spice things up as well. And, there's medical reasons, there's underlying medical conditions, whether you've had cancer or have problems with your genital anatomy as well, that may impact your natural ability to lubricate during sexual experience. So not only from a medical standpoint, but I'm going to kind of chime in and, bring Sheryl into the discussion a little bit to talk about some of the other issues that some women may experience that may benefit from this. And, Sheryl, before we jump in, some of the benefits I think for me are enhancing sexual pleasure, changes in discomfort, and really about the novelty as well, that this may be very helpful for some couples who kind of are struggling with sexual boredom as well. So Sheryl, it's really exciting for me to share the discussion with you. And I know you have a lot of really important things that you want to let us know about. So please chime in and tell us your thoughts as well.
Well, sure. And thank you again for including me. Patty, talking about lubricants, talking about anything that's related to female sexuality and male sexuality is so important. But lubricants are sort of the mainstay of sexual play. And so it's important that we validate and normalize the use of lubricants for women and couples of all ages. And so you have to think about when somebody's walking, through the aisle of a drugstore or going online, they are faced with a multi-million-dollar industry, and they need to know what's the right one for me. And it's kind of like condoms. It's not a one size fits all. And we need to help women and couples figure out what's going to be best for them. And so some of it is really about experimentation. Try a few things, get a variety pack. And boy, what a fun Valentine's present or birthday present to give a little box of, you never know what's in it. And so you can think about, and Erin will talk about all the kinds of lubricants, I'm sure, but women need to think about what's going to be best for them. One thing to think about is the fact that most women will need a lubricant at some point. They just will. And that's not about a stigma of what's the matter with their anatomy. And Michael, you talked about the fact that there are many women who have health-related conditions or anatomy issues, and they need the lubricants. but we really want to validate the fact that anybody can and should use a lubricant because, it can only help. Women will say to me, well, which one should I use? And I'd say, you need to experiment. We need to make sure that what is going to work for you is right for your body. So, for example, midlife women are probably going to need something a little bit more than maybe a 20-year-old. But then she needs to think about, do I want a silicone-based? And that's going to be great. It will last a little longer than a water-based. But we have to warn them, be careful, don't use it in the shower, because the last thing we need is a slip and fall, right? So I don't want to go on too much because there's a lot of topics I want to cover, but I just want to make sure that everybody knows that women of all ages can and should use a lubricant at some point. There is nothing wrong with their bodies if they need a lubricant, because I get that question, is there something wrong with me? Is there something wrong with my desire or my arousal if I need a lubricant? And the answer is absolutely not. Please don't use that as a stigma that there's something wrong with you. It is a multi-million-dollar industry for a reason. And if it can help, that's great. If you don't need it, but you want it for sex play and fun, that's great too.
That's the amazing thing about lubricants, is that there is a lubricant for every single different type of use, whether it's with your toys, whether it's with your partner. And I know, Erin, I am going to let you talk all about that. So this is one of my favorite topics. Dr. Krychman, I know that you've discussed that many of your patients have used Pure Romance lubricants. Can you share some of this with us?
Well, Patty, I want to back up a little bit and tell you about the preamble to getting the lubricants, because, there's this social stigma about women and their sexuality. And part of what I'm hearing from my many years of experience of talking to women, and, very often their first, journey into sexuality or lubricants was with a Pure Romance consultant at a party. Because remember, think about it. How do women really get a lubricant? I always joke and say, under the cover of night, wearing a trench coat, they drive 20 miles away from their home into a pharmacy where they, put 35 things in their basket, and they slip a lubricant underneath because they're so fearful that there's going to be a price check when they check out. There's this shame, as opposed to, the teen or the man who, pulls out a lawn chair, sits in front of the condom aisle, and is very much proud of his sexuality. So the first experience is about education and about that intimate discussion between your clients and your team members, really about educating women that one size doesn't fit all. And, I'd echo Sheryl's sentiments that there's certainly a lot of experimentation. There are a lot of specialty lubes. I think that, the color, the warming ones, the sensation line that you have has really had good experience for, the younger woman who wants to bring in, some tropical staycation experience, or, feelings at the beach and really spice things up with their partner. There's newer products, those that have CBD as well. And again, breaking the mold that it's not one size fits all, right? And I think there's twofold issues here. And I'd love to hear Erin's experience, because I think the education that you provide in terms of normalizing the experience and not vilifying women to explore that aspect of a lubricant. And I would echo the sentiment that women may not necessarily need a lubricant, but they may want a lubricant. They may be empowered to enhance their own sexual experience. It's not always about their partner, it's about themselves. And sometimes they need to be the active participant, right?
Hey, can I jump, Michael? You just brought in such an important point that the Pure Romance parties makes it a non-medical thing. That, first of all, I have to say, Most healthcare providers are not great about talking about sex, and they often know nothing about lubricants. They're sort of stuck in the old KY jelly mold. Oh my God. And so we need to bring them to the 21st century. So the idea that you can talk about lubricants outside of a medical setting is huge. It does normalize the use of lubricants as not for medical reasons. There are medical reasons, and we do want to teach our healthcare providers how to talk about lubricants too. So it is a kind of a two-edged issue here, but in the home-based setting, it is so validating. Women learn from each other, right? Who do you learn about your lubricants from? You don't. Well, probably not from your mother, but other friends and, and your girlfriends. That's who you ask. You often don't ask your healthcare provider. You should be able to, but you often don't. So it's nice to be able to have a variety of places to go for that information.
I think that's great because I think it's called paying it forward when you've talked to your girlfriends about the different types of lubricants. And especially if you attend a Pure Romance party, the consultant is going to be able to tell you everything about the lubricants and the different things that they're used for. Erin, let's go to this one. What different types of lubricants are available? And does Pure Romance sell all of them?
Yeah, so I just want to drive home the point that lubricants are not a one-size-fits-all product, like both of the doctors have mentioned. Women and men, both of them may own a number of lubricants to select which one is best for each individual scenario. So we've talked a little bit about different types, but let's go into each of them. So you'll have a water-based lubricant, and that's very versatile for everyday use. They're available in a variety of formulations. Most of the known formulations are gel-like, but they're also offered in emollient-based, which are best suited for men with rings or masturbation sleeves for the penis. Dr. Krychman brought up our Sensations line. So you have playful water-based lubricants that generally have a lot of flavor to them that are best for foreplay and just that arousal phase of the sexual response cycle. You also then have silicone lubricants, which are typically preferred for anal play. They'll last longer. They provide the largest barrier against friction. It is water resistant. So as Dr. Kingsberg said, you want to be careful when at certain stages in life because it can make the shower a little slippery. However, it is best for water play because it's not going to wash away so easily. We also have oil-based, the natural lubricants that are gaining a lot of momentum recently, but they do have some downfalls if used on a frequent basis. So aside from staining the sheets, the larger concerns are the fact that oil actually breaks down the efficacy of latex. So they're not condom friendly if that's a concern for the person and their experience. And they may even lead to higher rates of yeast infection and increased bacteria. So, and then another one that's really kind of gaining some momentum in the last couple of years are hybrid lubricants. And that's a combination of any of the previously mentioned types of lubricants. So those are going to combine the best of silicone and water-based formulas, and they're going to produce long-lasting products that are non-staining, they're easy to clean up. And Patty, as you mentioned, the best part is that Pure Romance, our partners are out there educating women and they're able to supply this demand, and our customers can find a lubricant from each of the categories that we've mentioned thus far.
I think it's best to have all the categories because it's like, why would you have a spice rack and only one spice? So, let's bring it all, because if it is the same old every day, it does get boring. And I really do think lubricants spice it up, and there's a great benefit to owning all of the above.
And Patty, one of my patients actually said to me, she said like her lubricant drawer is equivalent to her shoe closet, right? Because sometimes you wake up and you feel like wearing a certain pair of shoes, and it goes with your mood, and it goes with your activity. So it's not only about what you're doing and who you're doing it with, but it's also about the individual person, right? So individual sexual experience is varied, right? And some may enjoy water-based under certain circumstances, some may enjoy silicone at other times. So I think it's also very good to experiment with that and have, a multiple selection at your disposal. And sometimes even during the same experience, you may be switching activities, you may be doing other things. So keeping those handy is very, very important. And one thing I think, Erin, that I would love for you to comment on is something like the delivery system too, because a lot of women will shy away from lubricants because how to apply them. And they're not easy to apply, or they're messy, or they're, problematic, or they break down the spontaneity. But, I know Sheryl and I both agree that you can incorporate these into the sexual experience, part of foreplay. There are very good delivery systems. I love the stuff with Pure Romance, that it's a spray, it's meter dosed, it's controlled. And they all have different consistencies as well. So I think that's an important thing to remember, that, keeping those handy, having a variety of them, and really normalizing it into the sexual experience is really important.
Dr. Kingsberg, how do you determine what kind of lubricant is best for you and your partner?
Well, I think you're talking about the you being general, not me, but I will tell you that it really is about having a conversation, sometimes with your Pure Romance consultant or your healthcare provider, about what's going to be best for you physically. So, for example, if you are a postmenopausal woman who's struggling with some genital sensitivity and has a pH balance issue, and are kind of vulnerable to dryness, you may want to think about not using something that has a warming aspect to it, because that can be a little more sensitive. Whereas if you're a 20-year-old and you're up for some fun and some excitement and really want some innovation, that's going to be the right one for you. So you have to think about the reality of your body, your age, your genital vulnerability. But really, water-based is great because it's easy, and you can use it almost everywhere with anybody. But the silicone can last longer. So women who are, a little bit frustrated with having to reapply, particularly again, as women age, they often may need a little bit more lubrication. Using something like a silicone base lasts a little bit longer, so they're not having to reapply quite as much, which can take away from some of the sort of spontaneity of what they're doing. And you also have to think about the condoms that women who are having sex with men may be wanting to think about. So Erin was talking about oil-based, really can't use with latex condoms, but there are other condoms. You could be using a lambskin condom, and there are other, polyurethane condoms that can tolerate an oil base. So you have to think about what your partner is using if you're having sex with somebody who's using a condom, as well as just trying to figure out what you actually enjoy. Again, sometimes the fingers are the best place to experiment with. Take a few and figure out what the feeling is that you like for you.
I think that's great advice. I really do. It's experiment with it in your hand. So there are concerns with the type of lubricants to be used with condoms. And so somebody who's new to this, that's going to be buying their lubricant for the first time, do you say use a pea size amount? Do you say use a nickel size amount? What would you tell somebody using a lubricant for the first time? What's a good amount?
It's kind of the Goldilocks approach. Too little is not enough, and too much is gonna, feel like you're being drowned. So I would say, start with more than a pea and less than a beach ball, and somewhere in between is going to be the right amount. Actually, I would have them put it in the palm of their hand, and that way they can, again, it's experimenting, figure out what works in their hand before they then try to, incorporate it into their genitals. And that usually, women are smart, they can figure out how much feels good to them, because they don't want to feel sticky and messy. They really don't. But really, too little isn't going to do them any good. And so that's the message I would give, is kind of think about Goldilocks and say, you really just need that sweet spot, so to speak. And a little bit of experimentation goes a long way. The last thing you want is to accidentally sort of squeeze a bottle and have it all come out. And then, having a good sense of humor in the bedroom is also a really good idea.
I like that.
And Sheryl, I would say it's kind of like adding, salt to the soup, right? You do it a little bit and you see how it feels and how it's progressing. And then you can always add a little bit more and a little bit more. It's very hard to take it away.
Hey, Michael, first of all, you're a good cook. I know that. But what I wouldn't want to do is insult you by sitting at your table and putting salt in your soup. So you bring up a wonderful point,
Right.
which is, how do you use a lubricant and not feel like you are sort of embarrassing your partner by saying, you're not turning me on enough? And so that's a really important thing to sort of incorporate the communication that, it, again, validates for you and your partner that lubricants, A, can enhance sexuality, B, it has nothing to do with whether you're aroused or not. And that way you don't sort of, shame your partner or insult them.
And the other thing I think is important, Sheryl, is how do you incorporate it, right? And we're talking about empowering the woman, but I bet that if I would ask 10 women how to apply lubricant, you would get 10 different answers, right? So even the fundamentals, everybody says, oh yeah, just use a lubricant, right? But a lot of women have no experience with a lubricant. And it's like saying, just drive a car. Like I know kind of what to do, but I don't know like where all the intricacies are. So I think it's really important to get to the fundamentals. And what I tell patients probably is different than you. And I say, well, incorporate into the foreplay, engage your partner. It can be part of foreplay that you can apply it to your partner. Your partner can apply it to you at the opening, inside as well. So it could be part of a, we talk about sexual accessories, we talk about, vibrators and sexual lingerie and things to enhance, but let's not forget that lubricants can also be considered a sexual accessory. They can be used during the sexual act at various times by both partners with communication as well. So I echo your sentiments, but I also think it's important to get back to basics, right? And it's very important when you say, oh yeah, just use a lubricant. Many people, men included, have no clue about what that means, right? Oh, use a lubricant, and I'm talking from experience, right? I have 2 young kids, they're starting to drive, and I say, I feel like just drive the car. And they're looking at me like deer in the headlights. They need instruction. Sometimes back to the basics, I think, is really important.
Well, even one of the instructions about condom use, I mean, or, do you put it on the condom? Do you put it on, a woman? Where do you, or a man, where do you put, where do you start? And, or putting it on a penis if you're not using a condom, which way is the best way? And again, a little experimentation goes a long way. But many women would want that instruction so that they can feel sort of confident walking into the situation. And I would say it's always safer to put it on yourself before you sort of think about your partner. That way, it also is helpful for self-exploration. You need to know where your body is, what it feels like, what the sensation is. And so it kind of has a double value in that women who wouldn't necessarily touch themselves are now learning how to explore their own bodies.
Right. And before we jump ahead, I wanted to mention, we're talking about partner play, but it's also important when you're by yourself. And it's not just for heterosexual couples. Sometimes, you're involved in a same-sex relationship or, other situations. So again, there's no problem with using lubricants when you are by yourself with sexual exploration. And I've also, encourage women to use lubricants sometimes on other parts of their body. Sometimes the nipples are very, very sensitive, and they can be enhanced with lubricants placed on the nipples to improve sensation or, improve touch and what have you. So again, a lot of different things that we're talking about, but I think really important that it's not just for partner play. It can be by yourself. It can be with toys. And really the ultimate in versatility in terms of a sexual accessory. So it's important to open up that sexual pleasure chest and have a lot of different choices in there.
So Erin, let me ask a question. Can lubricants be used with sex toys?
The answer is absolutely. Not only is it highly recommended to use not only is it possible to use a lubricant with a sex toy, it's actually highly recommended. If you're engaging in self-pleasure with your sex toy, likely the amount of foreplay that you would experience with a partner is less. So since foreplay plays such a major role in your body's ability to lubricate itself when stimulated, you'll want to supplement with a lubricant, not only for, like Dr. Krychman was saying, improved sensation and experience, but also to protect the tissues of the vagina. Water-based lubricants, just like me, are the safest to use with a sex toy. However, Pure Romance has made major strides recently to ensure there are more options for those silicone lubricant lovers. The standard in our industry has always cautioned the use of silicone lubricants with silicone sex toys. However, we've been able to create a silicone lubricant called Pure Pleasure that doesn't break down Pure Romance's silicone toys, leaving them feeling sticky. So we're really excited that we now can have an option for those silicone lovers as well.
That's great. Is there a shelf life to lubricants?
Yeah, lubricants actually can expire. So the last thing you want to do is put an expired product in your most sensitive areas. The shelf life of a lubricant could be up to 3 years from production. So that actually translates to 12 months after opening. You want to make sure that, like I said, you're not putting something in your intimate areas that could cause you any discomfort.
So what's the best way to store your lubricants?
You always want to store your lubricant in a cool, dry place, such as a nightstand or closet. The shelf life of your lubricant is actually affected by the storage conditions. So if you keep a lubricant in a location that has drastic climate changes, temperature changes, it could cause your product to break down quicker, and then you're not going to get its full life out of it.
Good advice. Dr. Krychman, if you're prone to yeast infections or you have highly sensitive skin, what kind of lubricant would you recommend?
Well, Patty, I think the important thing is to kind of take a step back. And I'm, I have a clinical experience where I'm a tertiary referral, and I have a lot of women that will come in and say, I have a yeast infection. It has to be the lubricant. And I think we need to take a step back and look at the underlying conditions before we make that association. So although a lot of women feel like there is a link, very often there is not a link. There's an underlying medical condition that needs to be addressed, whether it is, changes in the vaginal pH that make yeast more likely. And, sexual activity in and of itself is a risk factor for a yeast infection, right? Blood, sperm, those all change the vaginal pH as well. So for me, I really have started to recommend more of the silicone-based lubricants for women who have this concept of their sensitive vaginal tissue, their vulvar area is sensitive. Some of the water-based may contain some preservatives. They may contain some things to prevent bacterial growth. I really recommend that you start reading labels and that you avoid things like bactericides, spermicides. Those are really known to affect the vaginal mucosa. But if you're prone to yeast infections, which we're now seeing actually as a result of this pandemic, we're seeing really a rise in yeast infections for women, and that's really about over-treating or under-treating or mistreating the infections that they get resistant strains. I think it warrants a medical evaluation. So to make that quick jump that, oh, it must be the lubricant, is not always necessarily so. I think silicone lubricants are anhydrous. They do not contain water. They won't affect the vaginal pH. I think if you are concerned about the vaginal biome, which is the new buzzword of the bacteria, the good and the bad that are living in the vagina, then silicone is the right choice. It's inert. It's not going to change your pH. And really understand that you've got to follow the science. You've got to follow the data. That there is really, very, very limited, hardcore, good evidence to support the fact that lubricants alone are the contributing factor to yeast. So really you need a good gynecological exam. You may need a vulvar vaginal specialist who is going to look at what kind of species of yeast you're having, what kind of pH issues you may be experiencing, what kind of drug resistance those specific species are. So it's a little more complicated, but I think really if you are concerned, I think silicone is the way to go in my book.
Okay, Dr. Kingsberg, some women seem to be ashamed that they need a lubricant. And how can we debunk this whole, the shame of using a lubricant?
So, Patty, women are sort of pressed into feeling shame about anything related to sexuality. Anything. So, using a lubricant is only one of a million things that women are sort of given a message they're not supposed to embrace their sexuality. So, lubricants are a great place to start to debunk that, but we need to, validate a woman's right to have a sexual experience and to have healthy sexual function, and to, use whatever she can and needs to use in order to make sex comfortable, enhance it, certainly pain-free. Too many women have suffered in silence with painful, sexual activity, whether it's by themselves or with a partner. We need to embrace the fact that we need to help them identify that they're in charge of their own sexuality, and that means no pain, no discomfort, and no shame. To use a lubricant, doesn't make them, dysfunctional or broken. That's number one. They are not broken. Almost every woman can make use of a lubricant. And at some point in a woman's life, she is going to need a lubricant. And that is a normal thing for women, right? Let's just validate that and take the shame out of, but why do I need a lubricant? And I will tell you, there are partners who will say, well, how come you need a lubricant? None of my other partners needed a lubricant. Well, that person is a little delusional and probably didn't pay any attention to the fact that their partner was probably using a lubricant. And there are many reasons why that person probably is a little blind. So we need to really wake up women to say, take control of your bodies. You are absolutely entitled to use a lubricant. It is part of normal functioning. No shame. They need to be able to ask about it. That's where the shame comes in. They need to be able to talk to their healthcare provider or their friends or a pure romance consultant to say, to even go to a party to say, I'm curious. I want to know how to, have a good sexual experience. And that's the part we need to help them open their mouths.
It's called permission, giving themselves permission.
And Patty, I think the important thing to remember about pure romance and about the PBF is, education is power. And I think that's really important. And that's part of our mission at the PBF is really to empower women to become educated and normalize. And this is, it should be something like brushing your teeth. It should not, there should be just a normal communication aspect of it. It shouldn't be stigmatized. It's a normal part of a sexual experience. And I think education is power, and understanding your body and understanding how it works and how it changes throughout the life cycle really is one of our important missions that we have. And I really appreciate the opportunity to help in that, reaching that goal, because once a woman understands and feels comfortable understanding her body, then everything else will fall into place. And that communication aspect, I think, is really important, normalizing it and really understanding that it's not about that they're broken and that something needs to be fixed. It's really about some of the normative aspects of sexuality and how they change throughout the life cycle. So really important to educate women on these aspects as well.
There you go. Education. Stay a student.
Hey, can I just, on the flip side of what I just said and what we all agreed on, which is lubrication is, using a lubricant is normal. I do think, Michael, you've worked in oncology for a long time. We really need to also empower women who have medical problems, who are afraid to talk to not just their gynecologist of primary care, but their oncologist, for goodness sakes, or their radiation oncologist about sexual concerns. And that's on the other side. There are medical problems that can occur in women that will leave them absolutely in need of lubrication. And we need to also help empower those women, again, not to feel broken and not to feel like it is the cost of survival,
Right.
but rather we can bring them back to healthy sexual function.
And I know Patty will endorse this. One of our big charges for the PBF was building a positive healthcare team and a sexual healthcare team.
Right.
And it's okay to fire your clinician, and and it's okay to seek a team that is really supportive of your needs. So, and we do have that resource. It's available on the PBF download. These are very, very important aspects to the road towards, empowerment and sexual vitality, is really building that team. And, you and I and Erin and Patty, we have no problem talking about sexuality, talking about lubricants, but unfortunately, as you mentioned, the norm really is, oh, yeah, maybe you need a lubricant, like get out. I don't really want to talk about that because I'm uncomfortable, or this is not the right forum, or be thankful that you're alive, or what have you. So building a positive team, I think, is key. And that is really about getting yourself educated about what is appropriate for you and what your needs are as a vital sexual woman. And if your team is not good, it's okay to tell them, I want a second opinion, I want a third opinion, a fourth opinion. And there are clinicians throughout the country, like Sheryl and I, who really want to empower women to have positive sexual experiences. So don't suffer in silence. And if your answers are not being met, seek out people that will help you help yourself.
I agree 1000%. I want to thank my guests, Dr. Michael Krychman, Dr. Sheryl Kingsberg, and Erin Harris, for a great conversation. And if you like what you heard today, please rate and subscribe to our podcast. For more information on the Patty Brisbane Foundation for Women's Sexual Health and our focus areas, visit the pattybrisbanefoundation.org. And remember, sex care is self-care, and sexual health matters.